CEN Exam Prep ENA. Question 1. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, diabetes mellitus. Option D, Cushing's syndrome. The correct answer is option A, hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 2. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A, systemic lupus erythematosus. Option B, rheumatoid arthritis. Option C, scleroderma. Option D, Sjogren's syndrome. The correct answer is option A, systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Question 3. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A, perform a 12-lead ECG. Option B, obtain vital signs. Option C, administer aspirin. Option D, assess the chest pain. The correct answer is option B, obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Question 5. A patient has been exposed to cyanide. What is the most characteristic finding? Option A, cherry-red skin. Option B, cyanosis. Option C, slate-gray skin. Option D, flushing. The correct answer is option A, cherry-red skin. Cyanide poisoning causes a classic cherry-red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate-gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Question 6. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 7. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A, positive Kernig's sign. Option B, positive Homan's sign. Option C, positive Brzezinski's sign. Option D, both A and C. The correct answer is option D, both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brzezinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Homan's sign, B, is associated with deep vein thrombosis. Question 8. A patient is experiencing acute panic attack. Which of the following is the most appropriate nursing intervention? Option A, administer lorazepam immediately. Option B, provide reassurance and remain calm. Option C, place the patient in seclusion. Option D, encourage deep breathing and mindfulness. The correct answer is option B, provide reassurance and remain calm. A calm, reassuring presence is the first line intervention for a panic attack. Remaining with the patient and speaking in a calm, quiet voice can help to escalate the situation. While lorazepam, A, may be used for severe cases, it is not first line. Seclusion, C, may increase anxiety. Deep breathing, D, is helpful, but the nurse's calm presence is the initial priority. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 10. Which fracture requires immediate surgical intervention? Option A, clavicle fracture. Option B, open fracture of the tibia. Option C, radial head fracture. Option D, ankle fracture. The correct answer is option B, open fracture of the tibia. Open fractures are surgical emergencies that require immediate antibiotics, tetanus prophylaxis, and surgical debridement to prevent osteomyelitis. Clavicle fractures, A, radial head fractures, C, and ankle fractures, D, are typically managed surgically or with delayed surgery. Question 11. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B, ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 12. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 13. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B. Tell the patient they must undergo the exam to report the assault. Option C. Perform the exam yourself to minimize the number of people involved. Option D. Delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice. Question 14. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A. Continuous nebulized albuterol. Option B. Oral corticosteroids. Option C. 4-magnesium sulfate. Option D. Immediate intubation. The correct answer is option A. Continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 15. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO 12 milliequivalent/L. What is the priority intervention? Option A. Administer regular insulin 4. Option B. Administer 4 fluids. Option C. Administer potassium. Option D. Obtain a urine ketone test. The correct answer is option B. Administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Question 16. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A. Apply heat for the first 24 hours. Option B. Apply ice for the first 24-48 hours. Option C. Begin range of motion exercises immediately. Option D. Avoid immobilization to prevent stiffness. The correct answer is option B. Apply ice for the first 24-48 hours. For acute sprains, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24-48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing. Question 17. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A. Naloxone. Option B. Flumazenol. Option C. Naltrexone. Option D. Methadone. The correct answer is option A. Naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenol, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 18. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A. Administer 4-lorazepam. Option B. Assess for head injury. Option C. Obtain a stat CT scan. Option D. Perform a detailed neurological assessment. The correct answer is option A. Administer 4-lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 20. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom? Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 21. A patient presents with sudden onset of severe, diffuse abdominal pain that is like a knife. The patient is lying very still. This presentation is most consistent with? Option A, acute pancreatitis. Option B, perforated ulcer. Option C, renal colic. Option D, bowel obstruction. The correct answer is option B, perforated ulcer. A perforated ulcer typically presents with sudden, severe, diffuse abdominal pain described as knife-like. Patients lie perfectly still because any movement worsens peritoneal irritation. Acute pancreatitis, A, is often severe pain but more epigastric and often radiates to the back. Renal colic, C, is flank pain. Bowel obstruction, D, is cramping pain with nausea and vomiting. Question 22. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A, obtain 12-lead ECG within 10 minutes. Option B, start 2 large bore 4 lines. Option C, administer chewable aspirin. Option D, draw cardiac enzymes. The correct answer is option A, obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 23. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 24. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B. Obtain a lateral neck X-ray. Option C. Administer nebulized epinephrine. Option D. Administer 4 antibiotics. The correct answer is option A. Assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Question 25. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A. Spontaneous pneumothorax. Option B. Pulmonary embolism. Option C. Acute coronary syndrome. Option D. Pericarditis. The correct answer is option B. Pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional.